the radial nerve can be easily identified at the axilla. We first identify the pulsating axillary artery, and you notice they have a fair amount of transducer pressure. The cephalic and brachial veins and other surrounding veins will take up a lot of the field. It's less confusing if we can compress those veins and see the pulsating artery. I like to refer this anatomic position as the clock, where this is our clock face. Anterior is towards the left, posterior is towards the right. Our radial nerve sits here, and oftentimes between 3, 4, and 5 o'clock on our clock. In this case, it's roughly at 3 o'clock. The ulnar nerve is here. This is the radial nerve. This is the triceps brachii, and we can see that muscle architecture there. Over on this side, we see the musculocutaneous as it traverses through the coracobrachialis. The median nerve is here, so we have both the medial and lateral roots of the median nerve that converge at that level. So our attention here is now turning to the radial nerve, and as I scan distally, we're going to see the radial nerve start to move and traverse down towards the spiral groove of the humerus. The radial nerve at the axillary level. Again, to review, you see the pulsating axillary artery. There's the component of the radial nerve, ulnar nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, and median nerve. Off to this side is the musculocutaneous nerve and the coracobrachialis, and so part of the triceps brachii is here. Now we can see that again in still image with labels. There again is the demonstration of the radial nerve, the position of the ulnar nerve, the median nerve, and at some level you can often see the contribution of the median nerve, of the medial root of the median nerve and lateral root of the median nerve. The axillary artery and its muscular walls, and the triceps brachii and coracobrachialis. Now with ultra-high frequency ultrasound, we can see some of this in more detail. Here again is portions of the radial nerve, and we see that designated by each individual fascicle of the radial nerve. The ulnar nerve again is slightly superior in this view, and in this position, as in the prior position, anterior portion of the body is to the left of the screen, and posterior, where the triceps brachii is, to the right. We can see again the medial cutaneous nerve of the forearm fascicles there, the median nerve fascicles here. And at this level of acumen, we can see distinct delineation in those fascicles between the bundle of the radial nerve and the bundle of the ulnar nerve. And we can also see a fascicle moving posteriorly and superficially. That's the posterior cutaneous nerve of the arm, branching from this portion of the radial nerve.